Hi Rachel, welcome to Three Rivers Oral Maxillofacial Surgery. How are you today?
I'm good.
Good. And what were you experiencing with your teeth?
I had a root canal that ended up going bad essentially. Like I had bone changes, and when that happened, there was nothing that they could do, so they had to remove the tooth. And I had a couple options. They told me I could do a bridge, or I could do, they kind of toyed with the idea of a bridge. They kind of weren't like thrilled with the bridge just because they were afraid with my age, and then with my teeth, that if they did a bridge, it would affect my other two teeth that, you know, could end up with issues. So they were kind of encouraging me to do a implant, and it was a no-brainer for me. I was like, absolutely. I was 28 at the time, so I was like, I want an implant. I don't want this tooth gone. And everyone was like, why are you doing it? I'm like, because I'm 28. Like, I can't have a tooth gone. It's gonna cause my bone to recede, which ended up happening within like the time that the tooth came out anyways. And I didn't want my face to change, and I felt like it was like aging, because when you don't have a tooth there, like you have bone loss, so you get that sunken in look and you age a lot quicker. So my dentist actually recommended Dr. Khan, and I called and I made an appointment for my implant.
Wonderful. So tell us about your experience so far.
Great, actually. Like the healing was really quick. I had a sinus lift with a bone graft and then the implant done. It was done in one appointment. I came, they did x-rays, they did a consultation with me. It was pretty quick. They made an appointment, and then I came in, and I think it was maybe like an hour and a half with everything. And I went home, and honestly, like the swelling, maybe about a week, but after everything, no issues, no complications, really just like seamless. So I was lucky. Fantastic.
So you are in the process of healing for your with your implant?
I had my actual impressions done yesterday, so they're making my tooth now.
Fantastic. And that's with your general dentist?
Yes. Mm-hmm.
Perfect.
She really loved it, because I was telling you that she's never had anyone come from, I don't think because when I came to get the impressions, she was like, this is so easy. She was like, I was in within like an hour and out, and she did the impressions and they did the x-rays. It was very quick. She was happy with them actually, because she had never experienced something so quick with the type of implant that he used.
Okay.
So she was really happy about that.
Perfect. So the healing happened really smoothly and nicely without any complications. Bone loss and facial change is a huge deal.
Mm-hmm.
I mean, it can make you prematurely age.
Yes.
Yes. And so you're on the way to getting that tooth restored fully. Do you have any concerns about how to treat your implant once it's complete?
I don't really think so. I know like they can't use certain equipment on it, and my dentist, like we've already talked about it, and all the girl, like my dental hygienist, I have my own, her name's Lisa, like she's fully aware. Mm-hmm. And it's nice that everyone stays in contact with each other, because like we can't use metal on that implant. Everyone's aware of that we have to take care of it. Other than that, I mean, it's like forever. They were really excited that I did it, because they were like, we never have to worry about this anymore. You don't really have to worry about that tooth anymore. So it's like stress-free now. Like anyone who ever like debates about it when they're like, oh, I'm just gonna pull his tooth, I'm like, you should really reconsider about an implant. Like it is an expense, but I think it's an expense that's worth it, especially when you're younger and there's so many issues that can come with it. Like you talked about, I mean, your face changes. There's just so many things that you don't have to worry about anymore with the implant.
You talked about the cost. How did you come about handling that? Because obviously we are all working.
Yeah. So I actually was joking with my dentist about it, because you get like your refund check every year. So what I did is like, and you reach, like it was 2 years in the process, so it took a while. So those 2 years, I just took my refund check and I put it away. And I was like, this is going for my tooth. But it ended up not being, I mean, granted I had a lot done, but it didn't end up being that expensive. And my best friend's a dental hygienist, She works in Boca Raton, Florida, and she was the one that was like, "You got a deal." She was like, "Some people are spending like $8,000 on their teeth," and I'm like, "Well, it wasn't $8,000, so that was nice."
Great,
So
great.
that was really nice.
This is terrific. Did you have any concerns? What was your experience in the office, in Dr. Khan's office?
It was great. It was quick. I mean, everyone was, helping me out. Anytime I called, everyone responded very quickly. I knew up front, like, what to expect. So it was very nice. It wasn't stressful at all, honestly.
Wonderful.
And then next year, June 10th of next year, I'm getting married. So for the photos, I didn't want, some people say you can't see it, but for me, like if I'm laughing or if I'm, being genuinely happy, my mouth goes all the way back. So I wanted the tooth there for all my photos to look back on to say, I felt good. I wasn't insecure. I didn't feel, ugly in the photos. So having that restored and in there, it's going to make the difference for my photos. And I'm not going to have to worry about, I can't smile as big as I normally smile because I have a tooth there now.